Hello, my name is PHppt, and I'm going to be talking about the successful evidence-based program that is designed against smoking in teens, called the NOT, standing for the Not on Tobacco Program. The NOT program was made by the American Lung Association, ALA, in collaboration with the Western Virginia University. It means to fight the increase in number of teen smokers and low availability of effective methods of intervention. The program is designed specifically for smoking teens ages 14 through 19 years old to help them quit smoking. Since I'm introducing the program as an evidence-based program, I will be providing evidence in this PowerPoint and references for the success of the program based on cessation rates over time. The first study involved smoking teenage age participants in the NOT program. It was directed and designed by the Western Virginia University, as it was comparing the result with another program in North Carolina that had a different methodology. The program split groups by one sex, or mixed-sex groups, and assigned different treatment methods to approach time and duration. Groups had teens in the ages of 14 through 19 and kept small-size class as a constant variable. The youths were also highly addicted to nicotine as measured by the Fagerstrom Tolerance Questionnaire. The one-sex group had the more intensive classes than did mixed-sex groups. Association same-sex grouping to associate to smoking cessation rates in teen smoking is a useful factor to consider when designing programs and understanding the influence that plays when adding the same-sex facilitators on the outcomes of the program, as studies show. The second study, called the Appalachian Teen Smoker, measured outcome of the program and if it made any changes in the lives of these teens in the 15 months after the program ended. Determinants of health. Factors that may affect the efficacy that could be considered when implementing such program are attendance, commitment, extent of biological addiction, and access to cigarettes. Attendance and commitment is when a teenager is willing to put in the effort needed to help themselves. Biological addiction is when they might require medical help, nicotine replacement therapy, and that requires parental approval for those under the age of purchase. Also to avoid worsening withdrawal symptoms when they occur. Diversity. Some people might not afford to be involved in the program, so subsidizing the program is important for those teens living in poor neighborhoods. Approaching different genders might require same-gender counselors to reach them, so that is something to consider. After the efforts to make the program possible, parental consent is a must for the teenagers to participate. Studies show that the aim of the program is to avoid chronic smoking in adulthood. The infrastructure of the program. Key players in the study included motivated teachers, nurses and counselors, coaches to help support the teens to quit smoking and help them stay on their way to cessation. Healthcare providers were also involved in the study. The cost of this study was mainly funded by the Western Virginia University Prevention Research. Since 1995, they had been studying the behavior of smoking teenagers, following them. They also have a cooperative agreement with CDC to decrease the financial limitation of conducting the studies. External stakeholders were involved to help them enhance the development of the programs. They partnered and received grants from the Western Virginia State Health and Education Departments and the American Lung Association, who also have vast majority in reducing the number of young smokers. All these organizations work together to design and implement and fund programs in the efforts of smoking cessation. Politics and ethics. Ethical concerns. The young participants have the right of privacy and being able to share anything with their program coordinators without being penalized, and also have the right to confidentiality of any information about themselves or progress not to be shared with anyone without their consent. When they sign up for the program and start their session, they have the right of being informed about the treatment options and potential risk in a simple manner. Opponents to the program include influences of the tobacco industry on the culture. The tobacco industry is switching their focus from traditional cigarettes to e-cigarettes. More teens smoke e-cigs than adults while the tobacco industry is profiting. Also, reduction in governmental regulations of e-cigarettes and vaping devices could potentially break the progress that put smoking rates among high school students in the US at an all-time low, according to the CDC. According to the NOT program description, the program started due to the fact that majority of smokers started at an early age. The CDC reports 45 million adults smokers started since adolescence in the US. And among the adolescents smoking population, two-thirds of smoking teens want to quit, but there is lack of support to help them achieve their goals. These factors were the reason that led to the infrastructure of the program, organizations that helped fund the program, and key players in the program that are ambitious to fight the tobacco industry and contribute in the advancements of public health. When it comes to introducing the program to a new community that is potentially interested in implementing the program, it is important to focus on what makes the program unique. The program is unique because it involves multiple key players that are professionals in their field that are focused on improving the outcome of the lives of the participants. The program is also easily replicated because every community already has those professionals that could be trained to do such work and achieve positive outcomes during the 10-week period of the program. Studies show program overall being effective and having a high success rates when compared to other programs that try to achieve the same outcome. That is reducing the number of adult smokers by preventing the progression of the habit from adolescence. The long-term outcome is worth implementation of this unique program in new communities. And according to the CDC, the number of smokers is at all-time low in the US in this decade. What sets this program apart from others that did not succeed is achieving the same result is the commitment, the fact that the designers of the program were committed to account for the barriers that could prevent the program from succeeding. Also, the fact that participants enrolled in the program seeking help and realizing they have an issue to solve was a major reason. The program was successful in helping these participants achieving their goals and overcome barriers. Short-term and long-term effects. Short-term benefit of the program includes increase in participants' productivity and overall emotional well-being, as studies have proven the possible outcomes. According to the CDC, since 1999, approximately 30% of students who completed the program successfully stopped smoking, and the rest reduced smoking. As time passes by, more states and communities are buying in the program, and population size is increasing as well, leading to more young participants stopping smoking and reducing the prevalence of lung cancer cases in the US in the long term. The program is easily replicated on almost any community scale. As long as there is necessity, it could be implemented in a short time period. I have referenced the studies in this PowerPoint in this slide to look at the studies and for your own reference. I hope you enjoyed my presentation and thank you for your time and attention.